Hi, my beauties. My name is Dr. Stefani Kappel, and I'm a board-certified fellowship-trained cosmetic dermatologist in Newport Beach, California. And today I'm going to be dedicating a video to Ozempic and Ozempic face. And the reason why I wanted to do this video is because where my practice is in Newport Beach, California, I have a lot of my patients on this medication, a pharmacologic agent for weight loss, which is actually engineered to be a type 2 diabetes drug. And we're seeing some changes in the facial structures and anatomy and fat loss and premature aging and fat atrophy and all the things. And I kind of just wanted to dedicate a video to this because we're seeing so much of it in my office, and I'm getting a lot of questions about it on my YouTube and my Instagram and my TikTok as well. So just wanted to dedicate a video to Ozempic and Ozempic face and what that means, and how dermatologists at different meetings and academic congresses, how we're kind of viewing the drug and why we're seeing these skin changes and what people are talking about it in the medical community. And you know, I always want to be a liaison between my patients and the general public and what's going on in the medical community, and kind of tie the two together and keep you guys on the forefront of new research and data and education. And again, all my content is non-sponsored, so I appreciate if you guys could share this channel with anyone who else wants non-sponsored content from a board-certified dermatologist. I remember the first time I heard the term Ozempic face, and it was actually at one of our academic meetings, and it was a dermatologist who was at the podium, and she was talking about Ozempic face and the changes that we're seeing with this drug and this medication in our patients who are on this drug. And she actually was a mentor of mine at UCLA when I trained there, and she had a practice in Beverly Hills, and so she was in an office where it was really prevalent, and a lot of her patients had been on Ozempic, and she was kind of talking about the changes that she's seeing in the office. And then there was further scientific lectures after that lecture, which talked about the pathophysiology and the changes that we see in the skin and why they're happening, and how we can address these changes as dermatologists by using stimulant fillers like Sculptra or Radiesse, or by using tightening devices like Softwave or Thermage. So I'll get into that as well, but I kind of wanted to focus on Ozempic in general, just as a new pharmacologic agent that we're seeing more and more of, and I'm seeing an increased prevalence of not only friends and family members on this medication, but patients in my office as well. And I'm seeing an increased number of those patients on this medication. So I figured I'd do a video on it, and then also the changes that we have, seen in the face and how we're addressing that and why they're happening. Because I feel like not just recommending treatments is important for you guys, but understanding the mechanism and why it's happening and why these changes are happening and how to address them. So hopefully after watching this video, that'll make a little bit more sense. And if you have any comments or questions, just drop a comment in the comments section, and I'll be sure to get back to you as in timely of a fashion as I can. So what is Ozempic, or Wegovy, or semaglutide? So semaglutide is a diabetes type 2 drug that is a GLP-1 agonist, and GLP-1 just stands for glucagon-like peptide 1, and it's a natural occurring hormone in our bodies that gives us the feeling of appetite suppression. It decreases gastric emptying, so the amount of time that it takes food to be metabolized through the gastric outlet into the intestines. And when we have delayed gastric emptying, that's the kind of the mechanism in which gastric bypass surgery works, you have the feeling of fullness and satiation, so your appetite gets dramatically suppressed. So what this means is there's a dramatic weight loss that can occur from people on this medication. And although it was originally FDA approved to be a diabetes medication, it is now FDA approved for fat loss, and it has really gone off the charts with how fast this drug has taken off. Now, I know a lot of influencers and celebrities, many of who we know, are on these medications, and now it's becoming more widely available to all of us. And because I'm seeing so many patients in my own office on it and the side effects that they're seeing, I just kind of wanted to do a video just addressing this. So because the GLP-1 agonist is a normal hormone in our skin, and it is in elevated levels of people taking this drug, you have the feeling of satiety, or you feel full, so you don't have that much of an appetite. And foods that you used to like, you're not that excited about anymore. And foods that are not that great for you, like fatty foods or greasy foods or high glycemic index foods that you want to stay away from when you're trying to lose weight, don't even sound good, or are foods that you have to really eat slowly or very limited amounts of. So it inherently causes a dramatic weight loss, anywhere between 30 to 40 pounds in 6 to 8 weeks is what I've read in the literature and what I've heard from colleagues. That has a substantial amount of weight loss that can have an effect on the facial aging process or what it does to our facial fat volumes and on the rest of our body. So it's not just on the face, but sometimes when you have a dramatic weight loss, you have a component of skin laxity or excess skin or saggy skin that can come along with that. So how do we address those changes and why are they happening? So you have to remember, when the body undergoes a dramatic weight loss in a short amount of time, not only do you get those changes with the skin because you're losing fat, and fat's pretty much like filler. So even when you lose, volume, or say you're losing it in your cheeks or you're losing it in your abdomen, by depleting that fat, you can get some of that skin laxity because of that loss of volume. But you also get a change in the skin as well that we're seeing is happening. And we're getting a decrease in collagen, a decrease in elastin, and those are the extracellular matrix proteins that keep the skin nice and firm and tight. So not only are you kind of sucking the fat out, which is like deflating a balloon, giving volume loss, sequelae, but you're also depleting the skin of the extracellular matrix proteins, especially the collagen, the elastin, the glycosaminoglycans, all those proteins that we try to increase with our skincare products and lasers and energy-based devices are getting depleted out of the skin because of this rapid fat loss from this drug, which, I'm not saying anything negative about it. I just really want to just lay it out on the table and go into the mechanisms of what's happening in the skin when people are on this medication. So you're basically in a malnourished state. So it can cause malnutrition, which can have effects on the body, but definitely effects on the skin. As you know, a skin is an outward representation of your internal health. It affects, our skin is affected by the way we eat. It's affected by our hormone levels. It's affected by our gut health. It's affected by our whole body systems. It can affect our skin. So when you're in a state of malnutrition or delayed gastric emptying with delayed, decreased appetite, and you're not getting the nourishment that you're used to or that your body is accustomed to, and you have this dramatic weight loss in a short amount of time, your body and your skin are depleted of nutrients, vitamins, minerals. So it has a dull, kind of lackluster, loose, sagging, thin appearance, the skin does. And so these are some of the changes that we see from this drug. So those are the changes in the skin. And again, it has to do with malabsorption, malnutrition, loss of collagen, loss of elastin, loss of volume, loss of skin turgor, and also because of the changes in our body from our endocrine system, our hormones, our gut health, and everything that's going on in our body being in kind of this malnutrition state. So just things to keep in mind. If you're thinking about getting on this drug and just knowing the effects that it may have on your skin and why, maybe you could choose healthier foods or maybe supplement. Now, this is out of my area of expertise as a dermatologist and a skin specialist. Talking about endocrinopathies and whole body homeostasis, as a physician I can touch on it a little bit, but I probably would defer to my endocrine colleagues for management of these symptoms, because my patients who are coming to see me for procedures to help counteract the effects that Ozempic is having on their face are asking also for anti-nausea medication. They're asking for Zofran, they're asking for medication to control their headaches and their, nausea, vomiting, diarrhea, abdominal pain, and things of that nature. So that's when I kind of defer to my other intercollegial physicians to kind of manage those aspects of the side effect profile from Ozempic. But as far as the skin, we can do things like biostimulatory fillers like Radiesse, which is calcium hydroxyapatite, or Sculptra, which is actually my favorite, especially for volume loss in the mid-face, which is polylactic acid, which stimulates your body to, and your fibroblasts, which are the collagen-producing cells in your skin, to make collagen and elastin and to help give that fullness back where it has been lost. So there's been other drugs in the past that have had kind of similar effects on the face, and one of them was a drug way back in the day called AZT. This is even before my time, before I was a dermatology resident. But patients with HIV and AIDS would be on this reverse transcriptase inhibitor drug called AZT, which caused fat atrophy. So a lot of people with HIV would have these sunken cheeks that would make them look gaunt and like really sickly. And because it was an epidemic of people on this medication, Sculptra became FDA approved to treat HIV or AZT-induced volume loss. And that's how Sculptra, I think it was in 2004, again, before my time, but it was introduced into the aesthetics world to help treat these patients. And I remember when I was a derm resident at UCLA, this was like in 2008 or 9, Sculptra is kind of becoming more mainstream, and we had a whole HIV clinic where we were treating patients with this lipoatrophy. The AZT drug for HIV had a different mechanism of action and a different pathway in which it affected the facial volume loss versus Ozempic. Ozempic just does it by malnutrition of the skin, a depletion of the extracellular matrix proteins, and depletion of that fat. You're losing fat not only on your face, but you're losing fat everywhere. And losing fat is going to have that volume loss effect of that sunkenness. Now, the AZT drug actually did something to the actual fat cells. It was specific for that fat. So even though it had a different mechanism of action and a different effect on the skin from a different pathway, Sculptra was also used to treat the AZT lipoatrophy and can also be used to treat the Ozempic fat atrophy, even though they're two different mechanisms of action. Another thing that we can do is anything to increase collagen stores. You guys know, if you follow me, Thermage is one of my favorite collagen boosting treatments when it's done correctly. The problem is when you look online and you see different reviews on Thermage, it's usually not being done with the right protocol. And I know this because I've seen it firsthand in offices that I visit when I go to teach, and they're using the wrong handpiece, they're cutting corners, they're not heat stacking, they're using the wrong vectors, there's an extender performing the device who doesn't really understand the physics behind it and can't really get the results of someone who is doing it by the book and in a more precise and very particular way, which gives really amazing results when you do it well. So that said, Thermage is my favorite for tightening up loose skin for my Ozempic patients. Softwave and Alltherapy are other really popular energy-based devices for tightening. They're not my favorite because I've worked in offices where I had all three of those devices, and the Thermage always was tried and true and gave the best results, especially with the protocols that we use. And I had the happiest patients, and that room was just bumping. It was more busy than the other rooms with the other devices, which is how I know and why I selected the treatments that I have in my office to be in my office. Those are the ones that have stood the test of time and have proven the best effects, and especially with people who have a substantial weight loss. Now, Ozempic or even just gastric bypass surgery or a dramatic, weight loss with an exercise regimen, it's the same kind of thing that we see, and the way that we treat that lipoatrophy and facial laxity can be a combination of biostimulatory fillers and energy-based devices. Now, Ellacor, which is microcoring, and the new tightening devices, which is giving us amazing results, especially it's FDA approved for lower rhytids and wrinkles of the lower face. I haven't used Ellacor on an Ozempic using patient yet because Ozempic is too new, Ellacor is too new, and I just really haven't looked into that yet, although some of my colleagues have published articles and case reports on that treatment for Ozempic face and the skin laxity that we see with it. So stay tuned for that, and maybe I'll experiment with that a little bit more, but I just want a little bit more data and speak to my colleagues who have been having great success with microcoring for skin laxity for Ozempic face. So this brings me to another point. I wanted to mention something because as we're talking about lipoatrophy, fat atrophy, and looking gaunt and sunken and almost sickly in the face, whether it's from Ozempic or running or of extreme weight loss in a short amount of time, I remember I had posted me at the gym at 5 a.m. doing my facial atrophy, what I like to call facial atrophy, avoiding cardio, right? Because I love doing cardio 5 times a week, and I've always been very mindful of not losing volume in my face. Now, certain cardiovascular exercises can make you have lipoatrophy or just have that like runner's look. And if your other derms following me, you know what I mean. You walk through them and you could tell a patient who is a runner from a non-runner in like a second. It's just, there's a look that runners have, and something that I've always been avoidant of it, even though I love running and I live right on the beach. I love doing beach runs, but it's something that I avoid because running does something to the volume in the face. And I've talked to my plastics colleagues, and I've actually remember learning about this in anatomy and physiology in medical school. Is it the pulling on the SMAS or the facial ligaments? Like, what is it about running that gives runners that face? And I remember posting something on my YouTube shorts just about a week or two ago, and I actually had personal messages from 3 different nutritionists and pathophysiologists and basic scientists who actually broke it down and said that there's something that happens with free radicals while you're running that breaks down the collagen and elastin in the mid-face, and that's why you get that sunkenness to the face. And again, for my running beauties, and again, I love running, I just don't do it because I try to do cardio that's not going to have that effect on my face, like spin or uphill treadmill or other ways of cardio that I've tried to really creatively get around without pulling on the facial ligaments or causing that fat atrophy. But I think treating those patients the same way that we're treating the Ozempic patients. They have a great response. They get the mid-face volume restoration, and also doing thermometer energy-based devices will give them that collagen back, which will give skin that like bouncy turgor that we're always chasing, and that could be lost with not only Ozempic but running or other medications that cause lipoatrophy. So going back to Ozempic, we've talked about loss of collagen, loss of those extracellular matrix proteins. And we've talked about how the skin starts looking shallow and dull and loose and thin. But what we haven't talked about is also with malabsorption and malnutrition, the rapid depletion of the fatty acids that make up the skin barrier. So that's another thing that we're seeing. When we look at skin under the microscope in patients who've been on Ozempic, you're seeing a loss of those fatty acids, which are an integral part of your skin barrier. So skin can get dry, flaky, itchy. So there's so many things happening in the skin. And I just wanted to do this video because I think people just assume that it's fat loss and that's why you're getting that lipoatrophy. But there's a lot of other components to it. So for those of my beauties who are thinking about being on this drug, just follow your physician's advice and check in with him or her regularly and be really in tune with your body, because although it's being used for fat loss, which I don't know if I 100% agree with, I'm a more natural route. I would say just eat clean, live the best lifestyle you can, be as healthy as you can, eat green leafy vegetables, eat your fruits and vegetables, have a low glycemic index diet, stay away from gluten if you can, as much as you can, stay away from dairy, just eat clean and clean, healthy living, I always think is a better alternative. But if you're going to go the Ozempic route, understanding why these changes are happening, not only in the skin, but in the body as well, and maybe make some better choices with the food that you're putting into your body, especially if you have a limited appetite and you're not eating that much. Drink a lot of water, eat green leafy vegetables, fruits and vegetables, still get your exercise. And I think that there's been studies have shown that people who are on Ozempic and exercise, there's some type of balancing act that happens in your skin to where you're not getting this significant weight loss with the loss of elasticity in your skin. When you're working out, it stimulates blood flow and it stimulates the removal of toxins. It stimulates the drainage of lymphatic fluid of this through the skin, and it's kind of like out with the old, in with the new, and I think it kind of counterbalances some of the negative effects that you see in the skin with Ozempic. So I think that it's really important, as with everything, eat clean, exercise, and live a healthy lifestyle, even if you're on this medication. And if you're having any of these symptoms, I know some of my patients come in to see me for Fraxel or for laser, and they'll say, hey doc, can I get some Zofran for my nausea and my vomiting? I would just say follow up with your doctor, because there may be something that you may need your labs checked, and it's important to just not ignore these symptoms and to address them and not just kind of sweep them under the carpet. If something's happening or you're having a reaction to this drug, don't go to your dermatologist for Zofran. Go to the provider who is experienced and can maybe not just mask these symptoms, but get to the root cause of it. Maybe your dosing is too high. Maybe your body's not compatible with the drug. So just keep an open mind and listen to your body. I can't say that enough. That's one of the most important rules in medicine. And they always teach us that in medical school too. Listen to the patient. The patient can feel their body, they're in tune with their body and what they're saying when they tell you that they're feeling a symptom or they're having a complaint. Like, listen to them. Don't just throw Zofran at them for anti-nausea. Figure out what's going on and make sure that it is from the drug, and just check their labs and be mindful of that. And aside from the skin, other side effects that Ozempic can cause, including nausea, vomiting, diarrhea, it can cause pancreatitis, cholecystitis, which is inflammation of the gallbladder or gallstones, renal failure, diabetic retinopathy. I looked that up on their website. I saw that diabetic retinopathy is something that's usually more associated with diabetes, but can somehow be related to Ozempic. So be sure that you're following up with your ophthalmologist as well as your endocrinologist. There can also be vision changes, hypoglycemia. There could be thyroid adenomas, even thyroid cancer, and other side effects that I'm probably missing and not including in this video. So again, just be in tune with your body and try to go a healthier way and a more natural way of weight loss. But if you do decide to get on this drug, just be very mindful and understand the changes that can happen in your skin, and be sure that you're being followed closely by a provider, especially the provider that's giving it to you. Because I know that there may be some providers out there that are just giving this out like candy, but it's really important to take responsibility and to maintain a tight relationship with your provider and be very in tune with your body and all the symptoms that you're experiencing. All right, that's my video on Ozempic, and hopefully if you have any questions or if I failed to mention something, drop a comment in my comment section and I'll be sure to get back to you. All right, you guys, thank you so much and take care.